And I think the issue I find personally is there's only a small proportion of us in healthcare that are actually advocating for the best quality of care that is not a first line transfusion, right? So I'm sure you guys see the same thing than me.
Hmm.
I have surgeons here who things like, why do you want to come 2 weeks before, 3 weeks before? Just we'll give you a good old blood transfusion and you'll be fine, right?
Hmm.
And so there's a it takes a lot because it's you have to convince patients and parents and for sure, but you also have to convince colleagues sometimes, oftentimes, and
Hmm.
institutions that if there's a way of doing it without transfusion, but why not? Like it's like if I was saying to the parents, oh, we're not going to fix your VSD, we're going to transplant you with a new heart, right? We
Right.
don't go that way. Like we know that this is not the way to go, and it's I'm sure many of you have heard the fact that transfusion is a transplant to some extent.
Hmm.
It's blood from a donor coming into somebody else's blood, and there are reactions and there are risk of side effects, and we have to minimize them as much as we can.